Thank you very, very much. When you consider Texas, when you look at the number of people in Texas that are 18 years and younger, we are number 2 out of 50 states. There are a lot of young people in this state. When you consider the number of children that are uninsured, we are number 1. When you consider the percentage of children in this country that are uninsured, we are number 1. That is not a good report card for the state of Texas. In 2003, when we were facing a $10 billion shortfall, I served on the Appropriations Committee and on the Conference Committee. And in 2003, with the budget cuts at that time, roughly 200 and 225,000 kids were removed from the Children's Health Insurance Program. That was in 2003. I want you to know that in 2011, the budgetary crisis in this state is much, much worse. Some will say it's anywhere between 6 to 7 times worse. This is not a time when we all say that children are our assets for us to balance this budget on the backs of our children. And that's literally what we are doing. I will tell you that the cuts in this budget are real. They are very real. And the children in the state of Texas are the ones who are going to be adverse affected from one end of Texas to the other. When you look at the Medicaid and CHIP funding, in that area alone, in that area, Article 2, the budgetary reductions are as much as $7 billion, right there with Medicaid and children. There are about 1.5 million kids in this state that are not covered at all. There are many more, millions, that will lose access. The provider rates are being reduced. And when the provider rates are being reduced, doctors who provide medical services for our most vulnerable kids, for the poorest of kids in this state, doctors are going to leave the program. And the question then remains, where will these children go? For many of these children and for their families, they will have to go to emergency rooms all across the state of Texas. And maybe there are people at the Capitol who have never been there. And you've heard personal stories already. But let me tell you, when I grew up, I was one of those kids. No private health insurance, no Blue Cross Blue Shield, none of those programs. My mom took us to the emergency room. And when you go to the emergency room, you just don't go in like you have an appointment. See a doctor and you come right out. You go in and you stay there all day long. And when you stay there all day long, you can't go to class, you can't study, you can't do anything else. And literally with this budget, if this budget passes as it is, thousands and thousands of kids in the state of Texas will end up in our emergency room. Many of these kids, like a little kid that was a member of my church several years ago, will not be covered by the Children's Health Insurance Program. Working family children, they will end up going without, and many of them will not make it. We're talking about those who are sick. But what the people in the Capitol need to know, that many of these kids are so vulnerable, and many of these families are living on the margins of life, that for them, we're talking about life and death decisions. And we are talking about not only where we are today in this state, but we are talking about the future of the state of Texas. And this budget, in the name of reducing the size of government and cutting back on spending, we are chopping off the future of the state of Texas, and we are saying we do not value our children. It doesn't matter what they look like. It doesn't matter where they come from. The reality is they are our children. I'll close with this. Someone once wrote that children are messengers that we send into the future to a world that we ourselves may never see. What sort of message will that be? I encourage you to tell the governor, the lieutenant governor, the speaker, every legislator, representative, state senator, not to balance the budget on the backs of our children, not to reduce the Medicaid and CHIP funding to the point that thousands of more kids will add to the list. And let's not keep Texas as #1 when it comes to the number of kids that are uninsured and the percentage of kids that are uninsured. If you want to be a first-class state, then treat the children right, and we will protect the future and save it for those who have yet to